Good morning. First and foremost, thank you for making the time to get together on this most important activity, the strategic planning of our medical affairs group. As you're all aware, our beloved Asian Hospital and Medical Center cannot grow and be ready for the future without clear directions as to the future of the practice of medicine from you all in this room. I must apologize for not being with you in person as I had other commitments booked already ahead. To put things in context, I'd like to begin by briefly going through our history as an institution as we plan for the future. These are just some of the key highlights. We will be celebrating our 24th anniversary this May, and in these past 2 decades and a half, much has been accomplished. The most important, of course, was our fifth JCI accreditation last year, plus the major acquisition of the CyberKnife for the stereotactic radiosurgery. These cement the fact that we are a world-class center with a large pool of top-notch doctors, nurses, processes, and capabilities. As you will also note, of the 294, soon to be increased to 323 beds once we get formal approval from the Department of Health, we are regularly having an occupancy of over 82%, with increasingly complex cases befitting an apex hospital. Financially, we're doing quite well, emerging from the pandemic with double-digit growth close to 20% for 2 years in a row and over 15% last year. And as I mentioned earlier, our census has been continuously growing quite significantly these past 3 years. You can see more detail in our growth with our CAGR of over 25% when it comes to the metric our investors are most interested in. As you're also all aware, Asian Hospital has been blessed with some key natural strengths in terms of geography, catchment area, the latest development, which has been the infrastructure put around us with the new highways that feed into SLEX. This has actually dramatically opened up Cavite and Laguna to Asian Hospital, which now contribute the second and third biggest segments of our patients. Mind you, 7 out of the 10 most densely populated municipalities of the country are within these two provinces. Top it off, we are relatively further off from our peers in terms of location. Medyo malayo ang St. Luke's, Makati Medical, Manila Doctors, Medical City. So we have these areas pretty much to ourselves. These numbers and results would not have necessarily happened even with our natural advantages if your management did not address a few key issues as we emerged from the pandemic. These issues included nursing engagement, medical engagement, the public perception of Asian Hospital, and unfortunately, our aging equipment and facilities. Let's go through these. First, nursing engagement. The siren song of better pay internationally wrought havoc on our staffing. We could barely support 110 to 120 beds with nurses. Over 50% of those hired would be gone within the year. By the end of the 1 year, close to 100%. We could see the patient feedback regarding our nurses was heading downhill. Doctors felt that management was remote, non-responsive to their needs. Suggestions for improvement. Patients were actually being brought to other centers as the technology we had here was already obsolete in many areas. The public, though admiring of Asian, felt that we were just only for the elite, with premium pricing for all our services. At the same time, our buildings were showing signs that it was over 20 years old, with leaks through the walls, equipment that ended their useful life, and difficulty scheduling procedures and tests. All of these needed to be addressed quickly. So, first and foremost, the nursing crisis. It really is a very simple equation. Nurses equals more beds, equals more admissions, and revenues for both the doctors and hospital. So we had to fix the nursing crisis. This was the immediate need. Fortunately, our Chief Nursing Officer, Carol Buhayin, and her team were able to link up with the top review centers and actually hire top nursing students who, when they actually passed their board exams, quickly joined Asian Hospital. This led to our ability to quickly ramp up to 140 functional beds by the first quarter of 2023. And with more hiring through the year, plus remedial training, mind you, these were pandemic babies with no hands-on clinical experience, we were able to close the year 2023 with enough nurses to support 160 to 180 functional beds. At the same time, we put in place the medium-term solution of trying to become the destination hospital for nursing graduates to be hired, similar to what SGV is for accounting graduates. That required a nursing training center with a simulation laboratory. We were blessed with a significant donation from Mr. Jose Marie Chan, and since the inauguration of this center, it has been fully booked by an increased number of nursing colleges working with our nurse educators just to ensure that their students got a hands-on experience. We do charge a small fee, so this center pays for itself. What has all this resulted in? A marked decline in attrition of nurses. We actually managed to retain at least 50% of the nurses we hired in end 2022, early 2023. This makes for much better skilled and experienced nurses, better able to deliver care to our patients. Feedback from patients has really been very positive about the nursing care they now receive. You, our doctors, have likewise invested tremendous time and effort to train our nurses in the specialty areas, particularly the surgical fields. Thank you very much for this. Well-oiled and drilled teams make for much better experience in doing surgeries in Asian Hospital, and you did this working with our nurses. The NPS score from our nurses has gone from negative 1% to now over 41% in just a year's time. We also have over 1,300 files, applications for nursing jobs here in Asian. So I guess we can claim that we have addressed many of the issues in nursing and we have become the destination, the place for hiring. Of course, we can never become complacent. We must constantly invest in training our new hires, even our veterans, keep everyone engaged in their life here in Asian Hospital. When it comes to the medical community, the first few weeks of my term was really spent on listening to all of your frustrations, your expressed needs, desires, and figuring out what we can quickly delivering on. Later on, we had to fix improving processes for field health submissions, collections, procedures, on timely arrival of patients in the operating rooms, buying the needed equipment, devices, even medical supplies, such as the proper sutures. Surgical instruments were always something that was top of the list. Ensuring we had the necessary equipment and devices, such as improving our CT scan, so we had to go up to the 256 slice CT scan, opening up a second MRI, competitive with our peer hospitals. We had to install all of these, get them running, and make sure they were competitively priced so that you and your patients would not have any qualms of having the procedures done here in Asian Hospital. Creature comforts, such as the doctor's lounge, strategically located just outside of Dr. George Garcia Surgical Suites, were also completed. It has been very gratifying to see how all of you have responded to our efforts to bring what you need at your fingertips. For example, just to keep one, the number of procedures in our cath lab, coronary interventions, have dramatically increased over time. In fact, 2025 grew by over 40%. The Net Promoter Score naman from the medical community has likewise been very encouraging to see. In 2025, we were at over 54% from a much larger number of respondents base. Hopefully, you can guide us to continue to be on the right path for Asian Hospital's sustained growth. We also embarked on an innovative marketing campaign designed to reintroduce Asian Hospital to the general public following the end of the pandemic. We wanted something that caught everybody's attention. Justine was just that, immediately accessible to the public, hilarious, and definitely attention grabbing. And the public lapped it up, got everyone curious as to who Asian Hospital really was. This then allowed us to then deliver new messages that were more traditional in the cool, engaging, reassuring manner with the voice of Inca, the voice of Philippine Airlines. As a result of this, the bar graph at the bottom of the screen shows the sustained growth of foot traffic and patronage of the services of Asian Hospital. As a lead indicator of our success, these growth numbers show that patients were coming into Asian to avail of the services we had. Previously in 2022, maybe we had about 600 patients per weekday. By the end of 2025, we are regularly hitting 1,100 patients per day coming into our campus to avail of services, procedures, consultations. Last year was also marked by our desire to really focus on our cardiovascular roots while differentiating us from the Philippine Heart Center or even Cardinal Santos and Makati Medical Center. We did this by helping the public understand the root cause of heart disease, even that of strokes and diabetes complications. Hence, Ate Rose was introduced to the public and medical community. She helped many people better understand what atherosclerosis was doing to our bodies, even helped people actually now be able to pronounce the word atherosclerosis. Of course, we did not leave the other departments behind. Every department working with your marketing business partner was also supported through press releases, TV, radio interviews, Facebook ads touting our services. With all the efforts, changes in how we engage our Asian community, we started reaping significant recognition from within the Philippines and internationally. All of these slides just shows, all the photos shows our excellence has been recognized. Excellence in clinical pathways, management excellence, IT developments, and our human resource practices. Just for example, in 1 year, we went from number 188 all the way up to number 88 as amongst the best employers of the Philippines as published in the Philippine Daily Inquirer. Just 10 days ago, we were recognized as the best clinical team with our Asian Cancer Institute and for Innovation of the Year as we brought into the country the CyberKnife. All of these rewards and recognition could not have been achieved without a clear clinical strategy that plays to the strengths that our hospital can bring to healthcare. For Centers of Excellence, we began with just the Asian Cancer Institute, followed by the Asian Cardiovascular Institute. Now, we have the Asian Brain Institute, Asian Institute of Respirology, Aesthetics, and the newest babies, our Asian Institutes of Surgery and the Asian Orthopedic and Musculoskeletal Institute, with many, many more to come. This is precisely where we need your help, your inputs as to where Asians should excel in. The inputs you give Carmen and the team today will definitely inform our investment plans and growth plans for the next 5 to 10 years. Just an example of what a clear-eyed focus on the Center of Excellence can deliver. Let's take the ACI as an example. Quite a unique setup actually, not easily replicated across other hospitals. Having an institute like an Asian Cancer Institute forced us to really look at it from 360 degrees. Infrastructure, equipment, doctors, availability of treatment facilities, supporting and diagnostic and therapeutic equipment, even drug prices. By being able to rethink how we price our chemoimmunotherapeutic drugs, we now actually sell over 90% of all the drugs consumed in our infusion center. Barely 10% na lang are brought in by patients as these are paid for by other charitable sources. This is a major win for both patient safety, assurance of the cold chain of these high-priced drugs, just-in-time availability, and of course, adding to the growing revenues of the hospital, now growing at over 27% in 2025 over 2024. We have already mentioned the cyberknife, but take note, with this investment, innovation, and commitment to treat pediatric cases, we were actually able to secure an income tax-free holiday period of 4 years on the revenues from this investment. Already, we see the growing number of SRS SBRT treatments delivered. These are highly ablative radiation therapy. By offloading from the tomotherapy unit, we are now able to do even more SRS SBRT and even our IMRT in the tomo unit. Again, increasing dramatically the number of treatments delivered per day and revenues generated. So the lesson: with centers of excellence, Asian Hospital working with the lead clinicians can and will make the right investments to foster professional growth, delivery of excellent clinical services to our patients, and of course, contribute to the growth of our hospital. So please, guide us, guide management, give us your inputs. Think about how each center interacts with each other, much the same way as we clinicians refer and rely upon the expertise of our colleagues to manage a patient holistically. So what does the future hold for Asian Hospital? Looking at the macro trends, we continue to see migration outside of the center of Metro Manila, predominantly here to the south, especially Calabarzon, in both businesses and people. The migration is contributing to Calabarzon remaining to be the region with the highest and densest population in the country. The NCD burden, non-communicable diseases, will continue to grow, even explode, especially with the growing aging population of baby boomers, soon to be followed by the Gen Xers. Anticipating all these population trends, also being the only tertiary and apex hospital in the area, and the growing demand for our services, we need to physically expand. This is the reason why we have off-sited the back offices of our operations here to the Mercedian, so we can give way to converting back to patient rooms the 5th and 6th floors of Tower 2. Why we are also expanding the capacity of our emergency department with the coming installation of a smart house that we can configure to manage emergency department visits of level 4 and level 5 acuity. Even with these measures, we can only physically add an additional 60 rooms to be at most close to 400 rooms in our current campus. We are fortunate indeed that Asian Hospital now has the track record and credibility with the MPH enterprise, that they consented to invest in procuring that additional 3,800 square meter lot between Asian and the FDA. On this space, we could build a 15-story tower above ground for at least 200 plus patient rooms, doctor clinics, centers of excellence, expanded number of operating theaters, intensive care unit beds, administrative offices with at least 5 basement levels to address our parking, warehousing, even future major equipment purchases. We are already working with architectural firms to identify the one which will do the master planning of our campus, integrating all of our towers, the podium, traffic flow, and hopefully create the plans that will fulfill our collective vision of what the expanded Asian Hospital and Medical Center can be and should be. So as we dream and plan for the future, we of course need to be ensured that the present is taken care of. We saw what happened in 2025 when the battle cry we called for, High Five in 2025, kept the whole organization focused on delivering the launch of the Meet at the Rose campaign, launching the Asian Learning Institute, launching the Cyber Knife, success in the JCI reaccreditation visit, and of course the move of back offices to Mercedian. This year, it's time for Fantastic 6 in 2026. with the big ideas powered by innovation and our information technology. Already, we have launched the Bayanihan floor. Now we need to populate it with patients sustainably. We are working on ensuring that our talented people, both employees and doctors, get the proper development to reach their full potential. We need to work together across specialties to deliver on an integrated, holistic approach to managing all the patients who come to our doors. That would enhance patient experience. We need to level up our campaign to defeat atherose here in Asian Hospital and continue to improve access to Asian hospital services, talent, and facilities, be it physically, such as improved parking, or through working out payment schemes in PhilHealth or other insurance organizations to ensure that patients did not worry about financial health. To close, this is the usual slide I share with the board. I hope I have given you the context by which we are currently operating, the actions that have gotten us to where we are today. I look forward to hearing and studying your inputs as to how we will build to get to our future. The vision that we all share for Asian Hospital is to take its rightful place, recognized by the world for excellence in clinical care, medical outcomes, and financial strength. Thank you very much. Good day to you all.